Hey class, I'm going to go to the trouble of recording my lecture, and it won't be as exciting as if you're in class, obviously, because I really like group and class participation, but we will try to make this work in case some of y'all are having to stay home, or in the event we have to close campus, which I hope that doesn't happen. And I have to fix this. Okay, so tonight we're going to talk about self-management. It's concept chapter 7. And a little bit of out of order of how I'm going to teach it tonight in class. That's okay. What I may do is if we have to stay home, I may try to get one of my kids to take the lectures for me. So, in this concept, we're going to talk about, define, and describe the concept of self-management. We're going to recognize levels of self-management, identify links that underpin self-management, and describe the role of interpersonal concepts. So the definition is quite lengthy on this slide, but basically it's kind of common sense, especially for healthcare providers. It's the ability, not only the individual, but the caregiver to engage in daily tasks to maintain health and wellness. Interestingly enough, we're talking about the COVID, so it's kind of something that we can put into this, but not only acute, but chronic illnesses. So, and it's not only just the physical, it's psychological, behavioral, and emotional. So it's kind of your plan of care. But let's talk about this COVID. How are we preventing it as healthcare providers, as parents? So it's all about washing our hands for 20 seconds, using a 60% alcohol-based sanitizer. I'm looking at this to see if it's 60%. Use Lysol on different areas. Use Clorox wipes. Okay, but what's also really important, and it's to stay home if you're sick. Cover your cough, not with your hand, but your elbow. Stay home. Stay home if you're sick, which is a big problem we have today, is no one stays home when they're sick because they can't miss work. They can't afford to miss work, and they can't afford to stay home with their children. So that's always an issue, right? So in the groups, I'm going to have you look up these other terms. What do these terms mean? Self-efficacy. What does self-efficacy mean? And we will be talking about that in class. But your text says it's having the confidence in knowing one's knowledge and ability to desire an outcome. So this is a really big one too. It's when we're doing education, when I did years of discharge planning, and it's changing slowly, but our baby boomers and our older population, some of them only have an 8th grade education. And so when we use big terms, or we go too fast, or we don't talk loud enough, they become, they get that feeling of, I can't get this, I'm not smart enough. But we need to build their confidence. So that's where you have things like the teach back method and things like that. Patient engagement, it's linked to the term above. Again, it's having the knowledge, the skills, the ability, the willingness. The willingness is a big one to participate. So when I think about that, we're going to use an exemplar in the next topic, but I think of children with diabetes. They have to not only feel confident to check their glucose, which hurts, and they have to be able to have that skill and that confidence to count their calories, count their carbs, and things like that. So that's a good one I like to use. But it's engagement. It's engaging the patient in their health care. Health education is learning experiences, right? So it's a way that we are going to get that knowledge across to them. I'm a firm believer that you have to use all learning styles, visual, audio, have them maybe write a sample diet down, because that hits all the learning styles And the teach back is another one in nursing they really try to get you to do. I don't know if I have one laying around, but a really good teaching tool that the hospital's developed, and I use in my dissertation, is the stoplight method. And if you see these flyers, they have them for every disease process. Mine was heart failure, it's my favorite one. Telling patients what to watch out when they're okay and when they're in danger, the yellow, and then when they need to call a healthcare provider when they're in the red. And I'm going to pause this for just a second and see if I can find that. Okay, so here it is. It took me forever to find it. And it's for a total hip, which I'm not that skilled on. But this is a great tool that they use at the hospital for education. If you add that with the teach back, you put information and numbers on here, it's a great tool for them. Okay, patient-provider relationship, it's kind of what it says it is. It's the relationship that I have with my heart patients. If you have a good relationship, a good rapport, they're going to hear you better than if they don't have the confidence in you or have that good relationship. Disease management is what it is. It's just managing interventions. I think of right now the CDC, how they're managing the cases of the COVID right now. So this is just a visual of optimum self-management on this end, absence of self-management. Okay, so attributes, we've already talked about these right here, but attributes of self-efficacy is going to be kind of all this: education, engagement, daily tasks, community-based. It kind of provides all of this within self-efficacy. You have these areas. So this is wanting us to get in a group and decide how attributes apply to a patient situation with chronic disease. So when we look at this, patients with self-efficacy through educational experiences will improve their knowledge and be more successful at daily tasks. Sorry, I'm having dental problems right now. And they're going to also engage in shared decision making with their provider and their caregivers, and they're going to link to community-based support systems. I always think of the houses along the hospital. If you have a patient with breast cancer, the Schliemann House is a perfect place to put them with, not only for mastectomy supplies, but for support emotionally. Patient engagement, again, greater efficacy. It's going to build their knowledge, build their confidence, and also align with necessary partnerships and healthcare teams to manage their chronic disease. Education, we're going to teach them about what's wrong. We're going to teach them what's going to make them better, what's going to slow the progression, what's going to help them have a better quality of life. And in like the heart failure situation, when to call a provider. Patient-provider relationship is essential to patient-centered care. That way they can express their concerns and feel like they have a voice in their care. Disease management is what it's all coming down to, is if we can get people to better self-management, better adherence, then healthcare costs are going to go down, and we're not going to have to be admitting so many patients for chronic conditions. I realize this was kind of, I don't have all of it. Okay, so now it talks about theoretical links. If you're like me, I am not a huge fan of the theoretical links. But it's important to acknowledge this. There's two theories, the social cognitive and the social behavioral. And the social behavioral is is part of this circular thing. You're going to have create thoughts and feelings, and then you're going to create a behavior, and you're going to reinforce the thoughts with the behavior. So again, I was going to have a group, and I'm still having a group discussion. We're going to consider a patient, what factors might be influencing the behavior, and what strategies are used to impact the patient. So there's numerous ways of using theories to help with behavior. Let's see, let's look at a patient situation. You have Margaret, she's 5 and she's a female, and at the age of 3 she was diagnosed with acute asthma and was admitted for 5 days. Two of those days she was in intensive care. Our parents made an appointment with a nurse practitioner to get advice on how to manage her asthma. And in the last year, she's been in the emergency room 3 times and to the urgent care 2 times. She's been on oral steroids, pronestellone, 4 times in the last 12 months. She's used a rescue inhaler, albuterol, at least twice weekly. And she's missed 12 days of kindergarten due to her asthma in the first 4 months of school. The nurse practitioner evaluates Margaret. Her vital signs and her BMI are normal. Her parents report that she receives her maintenance medication on most days, missing an average 1 to 2 days a week. Doesn't sound like it's very good adherence, does it? The nurse practitioner inquires about the family living situation and learns that Margaret lives with her biological parents and 7-year-old Labrador Retriever, which is an indoor dog. Her parental grandmother is a smoker and lives with the family during the winter months. The family's house is 76 years old, carpeted living and sleeping areas in a basement. The parents do not have Margaret's bedding encased with dust mite protectors, and the parents deny any mold, mice, or cockroaches in the home. The parents report Margaret occasionally wheezes with exercise but does not pre-treat her with a rescue inhaler. And I bet Angie's eyes are like this, school nurse, right? The nurse practitioner discusses to the parents the importance of daily medicine adherence as the first line of defense. And when she investigates further, she learns that the nebulizer sometimes gets in the way of the parents adhering to her daily schedule. She discusses with them the increase of daily dose and changes the administration route to a metered inhaler. The spacer, this is already used for rescue medications. The parents agree to make it a daily adherence easier. The nurse practitioner also educates the family about triggers, such as what? Smoking, dust mites, the pet inside, and how to approach the conversation. The nurse practitioner educates the parents on the bedding encasements for mattresses and pillows, provides a flyer, there's your visual, and where to purchase them. The parents agree to purchase the encasements because the parents report the cost of physical activity. She also wants them to pre-treat Margaret 2 puffs with a rescue inhaler before exercise. And so that'll also be something that they'll have to talk to the school nurse and get a care plan for. Finally, they discuss the importance of keeping track of her medication symptoms using application on a phone or paper-based recording. And the mother downloads a tool from the office to begin tracking. Based on the conversation, the parents and the nurse practitioner together update the asthma action plan and agree the following plan. And that is what the school nurse needed, the asthma action plan. The nurse practitioner asks the family to follow up in 3 months or sooner and try to avoid the ER or urgent care. Okay, so if you hear that, what factors might be influencing Margaret's behavior? So there's many, right? Her parents. She's young. She has additional parents, right? Grandma. Her fears could be a problem, and not understanding the disease well. Health beliefs could be in there. They didn't really talk about that, but depending on her culture. Education level and health literacy, that's a huge one. And then socioeconomic factors are really important. because what always gets in the way, and when we talk about adherence, is cost, right? So if these medicines cost a lot, it's going to be really hard for them to keep their child on it. And, you know, when I was a school nurse, and Angie can attest to this, we would get inhalers with other people's names on them, grandma, grandpa. I was relieved just to have an inhaler, even though they weren't supposed to do that. What strategies can be used to determine factors that impact the patient? So, ongoing frequent assessments with the nurse practitioner, trying to find out what barriers exist if they can't afford the medicines, trying to get them the medications through an assistant program. Asking direct questions is a helpful strategy. Don't beat around the bush. Provide non-judgmental support and ensure open lines of communication. Okay. The 4 important areas are going to be enhancement and wellness. You know, now your insurance will pay for wellness, so the well baby is really important, as well as older people getting their scheduled screenings. Pre-disease and disease prevention is a huge one. Disease new diagnosis and acute event management. Interventions include education. You're going to educate, making sure it's patient-centered and it's their desires and their wishes. If it's not the way they want to do it or they can do it, then they're not going to do it. So here's some interrelated concepts here. Also with that case study, there's a few other questions. So you can read this and think of some times when you were involved in self-management and some interrelated things that happen. Oh, care coordination is a good one when you have to call the social worker somewhere that's not your expertise. Another critical thinking questions is discuss where Margaret's family is in the scope of self-management. So think about that. And what health education is needed for Margaret's family. So this was kind of a fun topic, one that's important for RNs because one of your roles of an RN will be to teach, right? I got that all mixed up, but I'll fix it. Teaching is going to be, and educating is one of your highlights that you will do as an RN. Stay well.